Well, hi everyone, and welcome back to the show. This week I have Perry Eckert, and Perry is the master franchisee and CEO of Osteostrong, which is a system to help you make your bones stronger. So today's episode is all around osteoporosis, osteopenia, sarcopenia, what you can do to prevent it, why it's important that you consider doing something to make your bones strong, the risks that are associated with having osteoporosis or having a lack of bone density as you get older. And their system and the way that they use their machines to increase bone density, which is really, really fascinating. He also gives us a lot of background information on the science behind bone density and why you need to be, what you need to do from a nutritional and supplementation point of view, as well as the training point of view. So really an interesting podcast today with Perry. Before we head over to the show, I've got some exciting news. I've just released a book called Thriving on the Edge, which is an interview series with some of the world's top athletes, so elite athletes, ultra endurance athletes, of course, are in there, quite a number of them, people like Dean Canassis, but also people like Sir John Kerwin from the rugby scene, Conrad Smith from rugby, we've got Ray Sahab, we've got also a number of people who have had disabilities and done extreme sports anyway, so make sure that you check it out. It's called Thriving on the Edge, and it's all about the mindset of a winner, a mindset of athletes, what we can learn from extreme athletes, and I hope you enjoy that. That's over in my shop. If you go to shop.lisatamati.com, hit the books, Lisa's books, so you'll see all my books there: Running Hot, Running to Extremes, Relentless, and What Your Oncologist Isn't Telling You, and then the latest one, Thriving on the Edge. So make sure you check all of those out. I've also just launched a new company called Avum Labs, and you'll be hearing more about this in the coming months. I've teamed up some top people, so stay tuned. It's a longevity and anti-aging supplement range that we're going to be launching in the next few months, so it's going to take us a little bit of time to get organized. You'll still see all the other great supplements that I have in my existing shop over on lisatamati.com, but we're going to be doing some specific longevity and anti-aging supplements, so stay tuned for that as well. Really, really exciting stuff going on here. So without further ado, now over to the show with Perry Eckert. Well, hey everyone, and welcome back to Pushing the Limits. Today I have Perry Eckert with me. Perry, welcome to the show. Fantastic to have you here.
Hello, Lisa. How are you?
I'm doing better than you, probably, because it's 6 a.m. where you are and you had to get up early, so I've cut your sleep short. Apologies for that. Perry, we're here today to talk about bones, something that's very, very important. Can you give us a little bit of a background before we get into Osteostrong and what that's all about? Can you give us a little bit of a background about yourself and where you come from, so then introduce the listeners to you?
Sure. My name is Perry Eckert, and I'm the master franchisee for Osteostrong in Australia and New Zealand. We've been here for nearly coming up 4 years during the lovely COVID. Which has obviously had a big impact on most people's lives and the health and wellness business in total. So my background is health and wellness. I've had a lifelong interest in biohacking, extending my lifespan as well as my health span. I'm an avid biohacker, if you understand that term.
Oh, yeah.
And I've probably spent the best part of my life exercising in some form or another. I'm not medically qualified, but obviously that does not affect what we do, because we are an exercise program in the truest sense. Osteostrong is physical medicine. It's built around Wolff's Law, which is from the 1890s. It's one of the only medical laws still taught to doctors today, based around the concept that bones adapt to the forces we apply to them repeatedly. My other background is in manufacturing. I have a global manufacturing business. We do supply into New Zealand. We don't have any Osteostrongs in New Zealand, unfortunately, yet.
Not yet. Hopefully
but
after
we
this.
have eight in Australia. and more than
Wow.
175 worldwide.
Wow. That's pretty amazing. So Julius, the law that you mentioned there, so bones when they're put under stress, because I've got a background as an ultramarathon runner, and people are constantly asking me, well, aren't your bones in trouble? You've run all those distances and aren't your knees worn out? And no. After 70,000 kilometers or so, no, because I'm a true believer that the more you use something, the body responds and adapts to it. And we need to put our bodies under load, not overloading, but we need to load them in order to keep them strong. Is that sort of a principle that goes behind this law? Or is that what it's all about?
The short answer is no. The long answer is yes. Obviously, we do adapt to both muscles and bone forces. It's important, though, that there are dose requirements. So running, jumping, skipping, hopping, many of the exercises that the average person would be involved in, and if you go to a doctor with a bone issue, the doctor will advise you to do, apply loads to bones, which from a functional perspective, if you're running, jumping, hopping, skipping, load those bones appropriately, and you're able to continue doing those activities as you age. If you stop doing them, they become deconditioned. If you continue doing them, they stay conditioned. What has become deconditioned can become reconditioned, so people can not run and start running. And likewise, they can be a runner that stops running and ends up on the couch. The question you're asking, though, is does that sort of exercise improve your bone density? The short answer is no. You need a minimum impact to grow bones strong. So perhaps if we get into, why it's important to have good bone health, obviously as you age, you get weaker bones. So we reach peak bone density at about age 30. And from age 30, you start to lose 1 to 2% of your bone mass per year. Men lose less than women. It's a hormonal condition. Certainly during menopause, women lose between 2-3% and 6% per year.
Wow.
So by the time you're age 60, we were all meant to be obviously dinosaur poo by then. And physiologically, bones haven't changed from those early days. We can have a skeleton that's between 30 and 60% less in mass. And for women in particular, that means they're in a high fracture risk. For men, less so, but men go through menopause or andropause in their 70s due to reduced testosterone, and they go through the same process where they'll lose some bone density there. The upshot of that component is bone density. The second part of the equation is obviously loss of muscle mass. So as we do less, as we age, we have two things that happen. Firstly, your central nervous system can't hold as much signaling for bone density. So we also reduce our muscle mass. So the skeleton determines how much muscle mass we can hold. The less muscle we have, the less skeletal mass, and vice versa. So an aging person typically gets what we call sarcopenia, which is a loss of muscle mass, but they also get dynapenia, which is a loss of muscle strength. So a combination between all of those things is a loss of muscle mass and leading to bone mass and vice versa. We can get a combination of what we call osteoporosis or osteopenia. Osteopenia is low bone density. Osteoporosis is a lot of bone has been lost, and there's a score system which doctors use to evaluate that. And if you've got osteoporosis, you're a high fracture risk. Osteopenia is heading in that direction and warning signals. So you can be osteopenia, osteosarcopenia, a combination of the two, osteosarcodynapenia, new terms which refer to the aging process in general. So it's a natural process. It isn't necessarily a disease. It's just a condition of aging. Some people do, though, have physiological reasons why they lose a lot of bone density either early or later in life, and they're at higher risk than the average person. But it's something that affects most people in their life, either directly or indirectly. 1 in 3 women, 1 in 5 men by the time they're 60 years old.
Yeah. One of my teachers and mentors is a orthopedic surgeon and longevity and regeneration specialist. And she says that something, I've forgotten the exact stats, but if you break your hips or your pelvis after the age of 65, I think it was, you've got a 1 in 2 chance of dying within the next year. And people forget that this is one of the major killers, is having a lack of bone density. Like it's we all know about heart disease and cancers and all of these risk factors, but that actually if you break your hips or your pelvis, and that's pretty much a death sentence right there, and that happens very quickly, and that hormones play a huge role. It's one of the, I've talked on a number of podcasts about, hormone replacement, bioidentical hormone replacement under the guidance of someone who knows what the heck they're doing, can be valuable for supporting bone density and as a piece of that, puzzle, so to speak. But, what about the argument that people, give to me, like, well, even in general, when I'm talking about supplementation or something, they're like, well, do I need supplements? Because I eat a healthy diet. Well, that's always relative term anyway. And then are supplements enough, or is that still not enough? Like your calcium, your vitamin D, calcium's got pluses and minuses, vitamin D, all of those sorts of things. Are they an important piece of this bone density puzzle? Or not certainly, it's not enough?
So I say to people, if you sit on the couch and you drink a protein supplement, will you get stronger muscles? The answer to that is obviously no. So if you eat a healthy diet, you take vitamin D, you're getting sunlight, you take a calcium supplement, and you walk around the block occasionally, which is what the doctor tells you, will you get stronger bones? The answer is a clear no. So our body, our central nervous system needs the adequate dose required to trigger what we call osteogenesis, which is the bone growth. So our bones have 2 specialized cells, osteoblasts and osteoclasts. Up to age 30, osteoblasts are the cells that eat away old brittle bone, and osteoclasts are the new cells that come along and deposit new healthy bone. This bone remodeling process is constant and continual during your life. And normally the balance is that osteoclasts are above osteoblasts, but due to hormonal changes as we age after 30, it swaps around. So we see a net loss of bone mass. Having all of the nutritional requirements is one tick. I would question that most people don't have adequate nutrition, and there's a big list of things that people need to keep healthy bones. So bone isn't calcium, it's 35% collagen. And the collagen is there, it's a protein, it's one of the amino acids. It's there to keep your bones flexible and to be able to walk, run and jump. It's a functional part of bone architecture. Vitamin D is one of the minerals. It's the main mineral in the balance of the 65%. And we use the calcium from the bone in blood as part of our normal metabolism. And it's something that's very important that we have adequate vitamin D. But today's diet, most people get, calcium. Most people get enough calcium in their diet.
Yeah,
but
you don't need to supplement generally. No.
The other vitamins and minerals, so vitamin K2 is like the traffic cop that tells the calcium where to go.
Exactly.
If you're not getting vitamin K2, then you'll get, and you take supplements of calcium, you're likely to get kidney stones or blocked arteries. There are ups and downsides. That's
a really important point. I want to pause there and just reinforce that. I never give any of my clients a vitamin D3 supplement without a K2, MK7 attached to it, because and generally don't supplement with calcium unless there's some particular reason to, because as you say, we do generally get enough calcium in our diet. And if you take it wrong, and if the traffic cop needs to be there to put it into the bones and the teeth and the places where you want it, and not into the, arteries or where you don't want it, or kidney stones, as you said. And this is just, I just wanted to pause on that point and sorry to interrupt, but just to double down on that one, because it's a crucial point,
So if you're getting enough calcium, you need the vitamin D, obviously, because it aids the absorption of calcium in the gut. But then you've got magnesium, manganese, zinc, boron, copper, iron. There's a number of other vitamins and minerals that are in trace very important to bone metabolism and the processes that we go through. So it's not just one thing, but the other important component is protein. It's overlooked in many diets. Certainly vegetarian, vegan diets, it's more difficult to get adequate protein. And we know today that the minimum dosage, which is 0.8 grams of protein per kilogram of body weight, is probably not sufficient for bone and muscle growth.
Yeah, I'd agree.
So the number is hotly debated, but it's somewhere between 1.2 and 1.5 grams. And certainly if you're an athlete or someone who is performing muscle exercises, then the higher limit of something like 1.5 is necessary. Second component to that is, are you getting digestible amino acids or protein? Yeah. And when I look at that personally, obviously meat is the best source. There are complete proteins in vegetables, but they're not always bioavailable. And I quote to people the example that they currently use, which is the IDAAS score, which is the dispensable amino acid score. It's indigestible, dispensable amino acid score. IDAAS in short is the protein quality score. If you compare a small steak, beef steak, to 3 large peanut butter sandwiches that are half an inch thick in peanut butter, then from an amino acid score, from the digestibility of that amino acid, they're equivalent, but the calories are very different.
Yeah.
So
this is one of the problems. Yeah.
If you're getting sufficient amino acids through a vegan, vegetarian diet, it's something to be mindful of is the calorie load. And one of the other aspects of bone density is BMI. Obviously, the body mass is something that comes into consideration, both high and low. So obviously we see a lot of very thin women who look trim and terrific in middle age. They might do Pilates, they might do some other form of yoga, but they are typically score only 50% in functional strength testing. So they're not getting enough heavy weightlifting to develop fast twitch muscles. They've got a strong core, they've got great balance, they've got all the benefits that Pilates and yoga add, but they're not getting heavy weightlifting. They're not stimulating bone growth, and they're not particularly strong. So their risk in older age of developing osteoporosis and then falling and fracturing. So when you look at balance, it's a critical component of fall and fracture risk.
Yep.
Balance is a number of components. It's the proprioception as to where you are in time and space. It's the muscle strength to be able to recover if you stumble. It's also the reflex speed to be able to get your foot out quick enough. So a combination of fast twitch muscles, adequate muscle strength, and good balance combined. Perhaps Pilates and yoga are not enough for that. Yep. They're great exercises. I encourage people to do cross-training in a range of things. And Osteostrong, which we'll get to in a minute, is just one of the components of functional health. And it's not something that you can replace easily and safely. So the heavy weightlifting component of what we do is the safety aspect. So being able to lift heavy weights safely as you're older, and particularly if you've got low bone density, is a real challenge for most people.
Yeah, and you know, like I do genetics in my practice, and there's a genetic component as well. You know, you can have people who have more muscle and bone mass from the get-go. So, for example, my mum is one of those people, and we've been, you know, people who listen to my show know that I share a lot of stories from her journeys because there's so much learnings in them, and she had a, you know, aneurysm, stroke, and cancer, and was meant to die 100 times and still not. But we have to do weight training. We have to do balance training. We have to do all of these aspects. And she's still at massively high risk of falls because of her balance from the brain damage. And that's of massive concern to me, you know. So I do whatever I can on the balance, and then we do a lot of weight training. And I'm a big proponent of women, especially over the age of 40, really getting into their weight training. And we'll get into Osteostrong in a minute and specific types of what you do. But to me, it's more important, I'd say, from the age of 40 onwards, that you've got a big component of your training, cross-training regime is lifting heavy stuff, you know, in some way, shape or form, because if you're just doing cardio, and I see a lot of women doing this, and God knows I did it for decades, you know, where I just ran and ran and ran and ran. It doesn't cover all the bases. You need to be thinking more of in a holistic sort of a point of view with your Pilates, your yoga, your balance training, your reaction training, your speed, all of these things, which is really difficult to do, and we need to, but we don't need 5 hours, you know, running on a treadmill every week, or running outside. We don't actually need that much of the cardio. Dialing that a little bit back, unless you've got a specific, you know, training goal for a marathon or something, go for it. But don't neglect, is what I'm saying, this other side of the equation. And this is where, like, Osteostrong, when I heard about it through my colleague, Dr. Elizabeth Harris, you know, and she was like, oh, you'll be into this. This is fabulous. So let's dive into a little bit about what Osteostrong is specifically, and why, how and why did this come about, sort of thing.
Don Jaquish was the inventor of Osteostrong in America, and his mother had a bone T-score, which is the comparison of your score compared to a healthy 30-year-old. She had a T-score of -3, which was in the osteoporosis range. And he was doing his medical course in science, and he decided to look at the reasons for why people develop osteoporosis and whether there was a cure in some physical medicine. So he developed a piece of equipment that emulated high impact. He looked at gymnasts and found that they had the highest bone density. And so when a gymnast spins through the air and lands on the ground, they're absorbing up to 10 times their body weight.
Wow.
And that impact, he discovered, triggered osteogenesis, or new healthy bone growth. So he set about to build a piece of machine or equipment that puts you in your strongest biomechanical position. So if I use my arms as an example, when I bend my arms at 120 degrees, and I'm in that position where I would absorb a fall, I'm 10 times stronger there than through the full range of motion. I'm quite weak back here and I'm quite weak out here, but here I'm 10 times stronger. So he looked at the upper body machine, and there's a lower body machine, one for your spine and one for your core, rib cage, and built these 4 robotic machines that adjust to your specific body size shape. So you sit, stand on these machines, you're in your strongest biomechanical position, and you apply a self-applied load. So nothing moves on the machine. You hold the handles and you push, pull, lift. The core machine is like a chest core press, but it's quite different. So they're not isometric exercises, but they are a one exercise maximum. So you hold the position, you apply your load to your maximum comfortable level, and then you relax. It's a one-on-one machine in that you do one exercise on each machine and you're fully supervised one-on-one with a coach.
Right.
So we make sure you're in the correct body position and that the load you apply is quite safe, that you don't lock your elbows or get into a dangerous situation. And that reduces a huge amount of the risk. So obviously older people can't do a triple front somersault and land on the ground. They can't stand on a table and jump off. So being able to apply the sort of load that they do, and I'll give you some examples. Most people in a leg press type machine can press older women, 60, 80, maybe 100 kilograms if they're lucky. Men can get up to perhaps 200 kilograms safely. On our equipment, we start with what we call a slow start program, where older people are generally just put on the machine and asked to press until they're comfortable or lift until they're comfortable. And over a period of literally months, we build up their grip strength, their forearm strength, the muscles that connect, because it compresses not just bones, but muscles and tendons, ligaments, fascia, etc. And so to prevent that person from being or feeling uncomfortable or in pain or soreness, remembering that in a gym, young people, no pain, no gain. They crawl out of the gym and they think that's great. An older person goes into a centre and anything hurts, they automatically think that's an injury. It's not. It could be a muscle compression. It can be activating a muscle that hasn't been switched on for 20, 30 years. Obviously, it's going to complain and they'll have an ache or a pain and they'll go to the doctor and the doctor will say, if it hurts, don't do it. In our centres, the slow start program prevents that from happening in the first place. So we keep people highly safe and connected to their bodies, and we slowly work up to a level where they are able to apply a force. So this isn't lifting a weight or moving a weight through time and motion. It's able to apply a force far in excess of what they can do in normal weightlifting. So for example, on the leg press machine, I'm now able to exert a force of over a ton.
Wow.
Yet in the gym, I can only leg press several hundred kilograms.
Wow.
Now, going back to Wolf's Law, if bones adapt to the forces we apply to them, and I'm leg pressing 200 kilograms, my bones adapt to that level of force. But if I go to an Osteostrong centre and I'm able to exert 1,000 kilograms, then I can obviously adapt to that level of weight, and it's a significant increase. So we'll take one step back and look at why certain exercises don't trigger osteogenesis and why some do. So there was a study in 2012 by Deere and others in the UK that looked at running, jumping, the exercises that kids do up to age 18, and they determined that a force of 4.2 multiples of body weight was necessary to trigger bone growth, healthy bone growth. Forces under 4.2 did not trigger bone growth.
Wow.
We come forward, there was a study in 2015 that looked at high impact aerobics for women. Pre-menopause, 3.9 multiples of body weight, which is the maximum you can do in a high impact aerobic class. Pre-menopause, women had a reduced rate of loss of bone, but didn't gain bone. Post-menopause, 3.9 had no effect. So we knew that from the Deere study, 4.2 multiples of body weight, which means if you're a typical, if for example, you weigh 50 kilograms, you've got to be pushing over 200 kilograms to get a response to bone in the hip and femur.
Wow.
Now that's a significant
load.
amount of load. Walking, running, jumping do not get to that load. Swimming and cycling, in fact, deload bones. So you get mature age cyclists, ballerinas, very lightweight women who don't exert weights. They're never getting near those limits with any exercise they do. Certainly yoga, Pilates, Kaiser, most gym exercises, even lifting weights, don't get to 4.2 multiples for hip and femur, which is why when you go to a doctor and the doctor says, you know, ensure you have good nutrition, make sure you eat take the right supplements, and of course the exercise, do that, whatever that may be, or take a drug.
Specific.
And he knows the dosage for drugs, he knows the dosage for supplements, he knows the dosage for food. But I'm giving you the finger, but that's what happens with osteoporosis. You might as well just drink water, because typically doctors don't cure osteoporosis. They may reduce the rate of loss, they may address some of the deficiencies in your diet, and if they do extensive blood tests and look at P1NP and other components of blood that indicate either bone breakdown or bone deposition, then they may be able to direct you in the right area. But most doctors don't do the blood tests, so they don't necessarily know what the pharmaceuticals that you're on are doing. There's certainly, they have a toolkit. Obviously doctors have a toolkit, and that's what they work with, and they know what they're doing, but from a dosage perspective in exercise, they don't. And that's where Osteostrong steps in. We know that there are not only a minimum load dose, but in the case of the legs, there's a rapid growth trigger, which is 7.6 multiples of your body weight. So if you can trigger that, we know that from our studies, you'll get a significant improvement in bone density, provided the physiological aspects of your health otherwise are okay. Because there's many things that can prevent you from building strong bones. There are many drugs that you take. There are things that people do that they're not aware of. You know, they may have they have something like antacid tablets, which can be Mylanta, which is aluminium containing, or Nexium, which is a protein pump inhibitor. They prevent you from growing strong bones. You can be on antidepressants, immunosuppressants, androgen deprivation drugs, glucocorticoids, which are steroids for inflammation or some form of allergy. Those drugs all interfere with the bone pathways. And then, you know, early menopause, low testosterone. There's a series of things, diabetes, cancer drugs, all interfere with bones. And then there's the nutrition component. They're not getting enough protein, they're not getting enough collagen, they're not getting K2, so the calcium's going to the wrong place. They're not getting sunlight, which is why in the northern climates, northern hemisphere, Nordic countries, a lot of them have extremely low bone density.
They're right. Wow.
So
there's just a couple of comments on that. One of my pet problems is, you know, like proton pump inhibitors, you know, like they do so much damage, and they're given out like candy, as if they're really benign drugs, which they're not. They should be only ever used for short-term use, and they cause protein synthesis problems and mineral density problems, and, you know, nitric oxide problems, and therefore cardiovascular problems. And there's just so many reasons to get off you know, proton pump inhibitors or antacids. So that's, you know, one of the pet things that I'm trying to get people to understand, because most people just think they're benign. They're not. And then steroids are often used for so many things. And then I see a lot of cancer clients, and of course they're on some heavy duty stuff that really interferes, and often on steroids as well, and that can have massive impacts on the bone density. Or if you've had, you know, breast cancer or prostate cancer and they've wiped out all your hormones, that of course is a massive problem and ages you quicker. Or women who have gone through hysterectomies early or gone through early menopause, you know, these are all reasons for that process to speed up. And one of the reasons why, you know, like, try not to have those things. I mean, sometimes you've got to, but I do think we often take out hysterectomies too quickly. I know I've got, you know, in my own life, they told me I needed to have a hysterectomy or die, because I had fibroids and I was bleeding to death. I didn't die, and I didn't have a hysterectomy. And one of the reasons I didn't want a hysterectomy is because I didn't want to age faster. I didn't want my bone density to go down. I didn't want to go, you know, drop all my hormones off a cliff. So yeah, there is so many pieces to this puzzle, as with everything in the body.
Yeah. And look, we haven't touched on malabsorption syndromes. So this is something that most people don't understand the link between, obviously, some sort of irritable bowel or SIBO or candida, fructose intolerance, lactose intolerance, celiacs, anyone that's got a problem with a gut. They have to understand that that's affecting the gut lining, which is affecting the absorption of vitamins, minerals, and amino acids. And that doesn't include a whole range of parasites that, you know, people have, hookworm, threadworm, various other infestations, infections. Similarly, so everyone I know just about has some form of digestion problem at some point in their life. I think someone said the other day that half of all Americans have candida. All of those aspects to bowel health affect muscle and bone health in some way. And some of these problems are systemic, long lasting, and they'll have a devastating effect on bone density in time. So in our Osteostrong centres, we obviously don't do medical screening in those areas, but we do analyse the results of the people coming through our centres quarterly. So every person that comes through, we have an expected improvement in both muscle strength, balance, and bone density. We test for those regularly. So we see typically of a healthy person that's getting the correct nutrition, we see a 14.9% improvement in bone density in the hip and femur, and a 16.6% improvement in spine over a period of 6 to 7 months. We also see a 290% improvement in muscle strength over 3 years with an average 65-year-old.
Wow.
We see a 77% improvement in balance in as little as 5 sessions. So with this standard improvements, if someone comes to an Osteostrong centre and after 6 months or a year, they get no improvement, we know there's something physiologically wrong with them, and we then start a different investigation. They're coming to our centres, obviously, to get bone density improvement, but we see our members reducing joint and back pain, improving walking gait, improving their posture. They're obviously able to stand taller, straighter. The effect of not improving their bone density is a red flag to us, because it tells us to investigate further. Normally, it's something to do with the thyroid. So there's a hormone imbalance. That's the most typical, but it can be nutrition. It can be other areas of their medications or contraindications between medications. So that investigation then identifies usually a medical issue that is also serious and can be rectified. And then once that's rectified, they can continue their bone strength journey with us. But in the meantime, they've got better balance and we've reduced their fall and fracture risk.
And you've identified something else that needs to be looked at. Yeah, because this is always a multiple components. And this is the thing, I think, with everything in functional medicine and functional health, it is looking at, you know, we've got to look at the whole big picture, because the body is extremely complex. And when we go and throw in anything, from a supplement to an exercise to a drug, we're pulling 100 different things at the same time, and all these genes are turning on and off, and we don't, not as much as a lot of people seem to want to think that they know everything, none of us do. And we're actually pulling levers and things that we don't always understand 100% of the time. So we've got to do the best with the knowledge that we have at the moment, and you try and come up with a good holistic sort of a program. And Osteostrong seems like a really good piece of the puzzle. I wish there was one in my hometown. I'd get mum in there immediately, not to mention myself, because I think anyone over the age of 60 at least needs to be, I mean, earlier really, but really needs to pay attention to this, because it is a major killer. It's a killer. It's not just oh, I've got a bit of osteoporosis, it doesn't really mean anything, you know, like this is something serious. And I've seen women in their 40s and things that have got osteoporosis already, and very, you know, light, delicate ladies often, especially, you know, that just really need to look at this even earlier than other people. So you've got how many centres in Australia do you have,
We have
Perry?
8 at the moment. So
Yep,
in New South Wales, Manly and Crow's Nest. We
yep,
have 3 in Victoria, 2 in Melbourne, in Hawthorn and South Melbourne, and
yep.
1 in regional Ballarat, 1 in Adelaide in Connell Gardens,
Mm-hmm.
2 in Tasmania, Hobart and Launceston. So that's the 8 we have at the moment. There are 150 in the United States,
Wow.
and there are in 12 other countries. So Iceland, Denmark, Norway, Greece, UK, Mexico, Portugal, Greece, Iceland,
Wow.
quite spread out. But we're growing rapidly, and there's probably another 2 or 3 countries in the next 12 months. And we have it in plan at the moment, several more in Australia. We're talking to some people in New Zealand at the moment, but
Hopefully.
yeah, hopefully that will happen. It's certainly something that, you know, I'm very passionate about, and it is not just bones, muscles, and balance. It's also a number of rejuvenative technologies. So in our centres, we have red light.
Oh, I love red light. I have a red light clinic. Yep.
We have hydro massage therapy, which is
Wow.
an incredible bed that you lie on with a rubber membrane, and hot water jets go up and down your body. So it's in 10 minutes, you get a equivalent to a 1-hour massage. We
Sounds
have
great.
pulsed electromagnetic field mats, PMF
Also on
mats.
my radar. What do you think about that? I'm investigating that at the moment for my clinic and for me.
Very
Yeah,
good.
very good. Yeah, you having good results?
Cellular energy, anti-inflammatory, certainly for longevity. It's something that earthing is a critical component to cellular health, something that we don't do anymore. We walk around in rubber-soled shoes and carpets and artificial floors. We never get out and earth. And so if you're a Mesner fan from the late 1800s, early 1900s, then earthing is a critical component of cellular
Big
health.
fan. Yep, I agree.
We also have Normatec compression boots, and that's about lymph and blood flow.
Yep, I've got some of those. And these are all fabulous longevity, and you know, you're talking my language here. This is
biohacking, you know, biohacking 101. So we talk about lymph and blood flow, cellular energy, earthing, meditation, something that we don't do enough of. Women that come into our centre don't get my time. They don't get a period in a day where they don't have to be somewhere or something for someone else. So to be able to come into our centre and to relax for 10 minutes and just purely meditate and concentrate on nothing but themselves is a rarity. We're always under bad stress today. So there's always switched on. We're under stressful conditions that cause massive inflammation, I call it.
Yep.
And if you can go somewhere where you can relax, meditate, calm down, all of the feel-good hormones, we chase you with our 4 big machines. I call them our 4 big dinosaurs, where we put people into a flight or fight response mode, and then they escape from those 4 dinosaurs. So they come out, their feel-good hormones are racing, their balance is improved, they're connecting at a cellular level with muscles, tendons, ligaments, their balance proprioception at a level that they've never expected or experienced before.
Wow.
It's the lift the car off the baby moment. And they do this every week, and those feel-good movements every week just load upon each other. So we get people cancelling hair appointments and cancelling other appointments, but they don't cancel their Osteostrong appointment. They come every week. It's something quite unusual in the health and wellness business. Typically, only about 25% of people that join gyms use them regularly.
Yeah.
We get 100% attendance at our Osteostrong clinics.
Wow.
So there's something that in what we do that triggers at a hormonal level the feel-good moment and people walk out, their foot off the ground, they don't quite understand why they feel so good. When you come to an Osteostrong centre, you don't get sweaty, you come in the clothes that you're dressed in, you don't have to put on sports equipment, and we deal with people from, the youngest is probably 15, the oldest is 95, provided you're not under intense pain, provided you don't have muscular dystrophy or unmedicated hypertension or an active hernia. They're the contraindications to our science. And most people that walk out feeling better than when they walked in. The component of joint and back pain, which is a side effect of Osteostrong, it's not something that we advertise or talk about apart from in shows like this. Typically, when you have a joint that's in pain and you move it, you cause more pain. But there was a study that showed, it was by Benjamin and Ralphs in 2009, and it showed that when you compress a joint and relax it, you pump synovial fluid out of tendons and ligaments into the joint.
Makes sense.
You get hyaluronic acid and synovial fluid, blood plasma into that joint, and as you relax the joint, those fluids with metabolic wastes get absorbed back into the tendons and ligaments. So over a period of time, you're getting this injection of fluid into the joint every week.
Wow.
And you get a slight lubrication. You also get blood flow, so tendons, muscles, ligaments around the joint capsule get stronger. You feel less pain, so you start to be able to move a little bit better. The more you move, the more you can move, until the point where you get that joint mobile again. So we get, usually within 5 to 10 weeks, people report significant reduction in joint and back pain.
And this would be so good for people who, before you go to surgery, like, before you take the drastic step. I broke my back when I was 21, and I had 2 discs that were completely, buggered. And now I've got 4 discs that are completely buggered, but I have absolutely no pain because of what you've just said. I mean, I don't have Osteostrong around the corner, but I do a lot of loading and a lot of heavy lifting, and I keep my core really strong, and I have an anti-inflammatory diet, and I put in supplements like hyaluronic acid and glucosamine and all of those sorts of things and other things. And I don't have any pain anymore, despite the fact that those, discs are not in good shape. They're bone on bone. But I used to have hellish pain, and I used to have 10 seizures a day where I'd be like this on the floor, and I never thought that I would ever get to a pain-free state, but I am. I'm completely pain-free. And I didn't have that, like when I was a 12-year-old, because I was a gymnast as a kid. So I had pain from the age of at least 12 years old onwards. And now at 55, I don't have any pain, and I haven't had an operation. And they said, you need to fuse all of the discs in your back. And thank God I didn't. And instead I went the route of trying to work it out myself, and it took many years and lots of, playing around and tweaking and doing. But it's an anecdote. It's an N of 1. But I know that joints can be extremely painful when there's actually. You also get a lot of people who have a lot of back pain, and actually it's a gut problem. They've got SIBO, or so got a problem in the gut going on, and that's pulling and causing the pain. So looking at the whole anti-inflammatory lifestyle, diet, and exercise and supplements and all of that is also an important point. So I just wanted to, reinforce what you said. I do a lot of yoga and things like headstands and stuff like that, which put a heck of a load on your neck, right? But actually my neck's gotten better by doing just that, because I am putting load. And it's a bit like, compression when you do, you use a flossing band around a muscle, work that joint out, and then let it go, and you let all of the blood flow back in and push all of that stuff back out of there, all the bad stuff that's there, and bring the new stuff in, so to speak. All of these little tips and tricks that you can add to your regime to sort of get you where you need to be, rather than just going, oh, I've got a really bad back, therefore I'll go and get a back surgery, because I've got
You're 100% correct. And people use the genetic example all the time. It's my genetics. We know today that 85% of our metabolic health is due to lifestyle and nutrition. We know that only 15% is actually genetic. The balance is epigenetics, and epigenetics can be altered. We have to take responsibility for our own health. We know that for older people, buying a mattress to put at the bottom of the cliff is not the answer. People spend 85% of their lifetime health budget in the last 2 or 3 years of their life, clinging to the hope that when they fall off the cliff, they'll land on that mattress. And the reality is that most people miss the mattress. It's a horrible analogy, but people don't accept responsibility for their health as they age. And we know that by the time we get to age 50 or 60, half of us have 3 or more comorbidities to do with diabetes or one of the other metabolic conditions. And so that's the other component of Osteostrong that I haven't mentioned. We did a pilot study back in 2015 where we took pre-diabetic people, we put them through the program, and we found that there was a 0.6% reduction in blood glucose as a result of the program, which doesn't sound like much, but the best medication for diabetes type 2 is metformin, and that gets a 0.3% reduction. So if you multi-stack the environmental lifestyle aspects, which is nutrition, exercise, metformin and Osteostrong together, you can get a significant reduction in blood glucose. And we've had members report that they've been able to reverse or eliminate their diabetes type 2, which is, as I've said before, a lifestyle modifiable factor, and it can be cured.
Yep, I've had so many people that have, worked with diabetics, type 2 diabetics, who we've, reversed, if the people were willing to do the hard yards, the diet, the change in the lifestyle, the exercise, getting there, and it takes time. But some of these people have been diabetics for 20 years, but no one's ever explained to them the mechanism of what's actually happening, and they don't even understand the basics, like I'm eating a healthy diet. I have fruit salad for lunch,
That's right.
Banana with an orange and a kiwi fruit and an apple and a pear. That's healthy, isn't it? Well, no, not for a type 2 diabetic who's not doing much. It isn't.
No. And look, we don't give, we're not there giving advice as an Osteostrong business. That's not it. We're not diagnosing medical conditions. What we do know, though, is that if you follow our program and you come for a set period of time, the sort of examples that our members give, I had a lady come in, and I try and talk to the members when I'm in the centres, and she said, haven't really noticed the difference. And her husband said, well, except you don't take Panadol anymore. And she said, what do you mean? He said, well, you've had chronic back and joint pain. You take 8 to 10 Panadol a day. You haven't been taking them since Easter. And this was about September. And she said, oh, yeah, you're probably right. And he said, well, not just right, but the effect of those tablets, if you take 2 or 3 tablets, different tablets, you double and triple your fall risk, because they all affect your balance and they affect your proprioception. So older people that have multiple comorbidities, that take multiple blood pressure, diabetes, pain-killing tablets, they increase their fall and fracture risk significantly.
Is that right? That's news to me. I didn't realise that. Well, it makes sense, because they're going to affect how how onto it you are.
Neurologically, they all have an effect on your brain in some way, shape, or form. So we had some old ladies that I interviewed, and one of them said she got her dignity back, and I actually teared up when she told me this story. She said, I've been married for 80 years. She was a really old lady. She was in Sweden, and I think she'd forgotten how long she'd been married, or maybe she didn't like the husband. And she said, when I get off the toilet, I can't stand up anymore, so he has to pull me off the toilet, and my pants are down, so he's never seen me naked, and so I have no dignity. And I said, so what's changed? And she said, well, within 3 months of doing Osteostrong, I had enough leg strength to be able to stand up again from a sitting position.
Isn't that
And so
beautiful?
she was able to stand up, pull her pants up. She got her dignity back. We had a 93-year-old at our Hawthorn Centre. The first time she came in, she was brought by her daughter on a walking frame. Within 12 months, she went from a walking frame to a walking stick. And then I remember the day she came in waving her walking stick. So she no longer needed a walking aid. She still carried the walking aid as a balance security blanket, but she didn't need it for everyday life. We had a lady who said she got her independence back. She was able to open a jar of pickles that she hadn't been able. She had grip strength again. She was able to use her wrists. She used to go down the hallway and ask the old man to open the pickles. She said, I still go down the hallway because I like him, but I open my own pickles now. So we get some amazing stories from quite old people in their 80s and 90s that have been able to reverse their natural loss of muscle balance and strength, and they're now able to live better lives.
A little bit more independent, like, and as someone who's been dealing with a mum who's, for 8 years, caring for mum and rehabilitating her and taking her from a wheelchair for 2 years, she was in a wheelchair predominantly for 2 years. It took us a year to get her out where she could take the first couple of steps in a parallel bars, and she was bent over like an L, like this. And then to rebuild her so that she's got really good posture now, and get her walking and get her back into the gym. And once we got into the gym, to rebuild her strength. And it's an ongoing process because she's since had brain cancer and about 24 concussions from falls and and GI bleeds and God knows what, but she's still able to get around the house, take herself to the toilet, go and have a shower by herself, and go for little walks by herself. And that's someone who's been through the absolute ringer. And during that period, I've seen her go right down to not being able to sit on her own, like just flopping over, even sitting, to doing all of these things. And I've written a book about it called Relentless, which was just the first part of her journey. I haven't done one on the second and third part of her journeys. We're always in the middle of the next one. I've got to write a couple more books on her, but to see someone go from there to there through consistent training. And like people were often saying to me and criticizing me, and I hear it all the time, you're such a nasty daughter, you're so mean to your mum, why do you make her get up, why don't you help her up out of the chair, why people see me out and about with her and I don't help her up very often. Sometimes I have to give her a bit of a nudge at the end or whatever, but I try to make her brain engage with her muscles so that she can learn that process. If I do that for her all the time, she's not going to learn it, and I need her to maintain, and she deconditions really quickly. We just had a bout in hospital last week with GI bleeding, and of course she was stuck, unable to get up because she'd bleed to death. So we deconditioned. Now we're on the comeback trail again, and you decondition within 24 hours when you're that old. You have to be religious. Like, I don't let her have her birthday off. I don't let her have Christmas off. No day where she's not training. And if I don't, she's gone.
And that's that's one of the key components to Osteostrong as well. So when we do the strength training, the one and done exercise that we do is myofibrillar hypertrophy, not sarcoplasmic hypertrophy. So if you go to a gym and you do multiple reps of lower weights, you build up sarcoplasmic fluid in your muscle, you do increase in strength. But then if you don't go to the gym for a day or a week, and as you get older, 5 minutes, that sarcoplasmic fluid and strength training effect rubs off very quickly. At an Osteostrong centre, we're exhausting muscle ATP in a 10-20 second exercise maximum effort.
Wow.
And what happens is we don't get big and bulky like a gym, but we do increase the number of muscle myofibrils. So the density of the muscle fiber increases. And that is a long-term result. So typically older people come to our centres, they take 4 weeks off or 8 weeks off. They go on a holiday, they come back, and they will sit on the machine and do a record. They'll do a personal best because they've had a rest for several months. They don't. We don't waste. Once you've built a muscle fiber, it's there, and it doesn't waste away. So people typically don't lose their strength if they don't come for a holiday or period away from the gym.
Yeah, because but usually.
That's how the diabetes works too. So as you increase the number of muscle fibers, myofibrils, you increase the muscle's ability to process blood glucose.
Yeah, yeah. That makes a whole lot of sense. Wow, I didn't know that. So that's really good. So when you're doing that maximum full effort where you're doing the multiples of weight, then you actually do a different thing than when you're doing like free weight, because you couldn't do this with free weights, no. Like you'd injure yourself. So that's why these specific machines are required to, and guidance is required to do it.
They emulate high impact events in a single lift, push lift. And the 4 machines cover arms, legs, spine, and core. And the core is important because as we age, a lot of the red blood cell production is from our collarbones and from our ribs. The bones are different. We obviously have hard and soft bones and trabecular and cortical bone, and those bones have different functions, but they also have functions in blood health. So it's very important that we have a healthy bone for good blood flow, because that's where all our red blood cells, white blood cells, platelets come from, is this soft, spongy bone. And it's important that if you maintain that health, you also have good blood health, because a lot of the drugs like bisphosphonates switch off the cell, which is the osteoclast. Now, the osteoclast-osteoblast ratio is important, but if we don't have the osteoclasts eating through the old bone, removing old brittle bone, we get an accumulation of hard, brittle bone, but we also don't get the micro blood vessels in the bone, because as these osteoclasts bore their way through, they create these micro blood vessels, which is important. So if you talk to a doctor or even a butcher, if they scrape new bone, the bone bleeds. And that's blood coming out of the bone. That's how one of the main sources of blood. If you switch off with a bisphosphonate, the drug that stops you from eating old bone, this accumulation of old brittle bone, not only do we start to see a small number of spontaneous dual femur fractures, we also see necrosis of the jaw. Some of these drugs are quite nasty, but it's important that people obviously see a doctor, talk to a doctor. There's a combination of strategies for bone density. There's a number of studies that are being done on Osteostrong at the moment, one in Greece. It's been completed by one of the leading endocrinologists in Greece, found that the preliminary report was presented to Endo 23 in America this year, and it showed that Osteostrong had a significant effect on bone density and that it works synergistically with bone drugs. So there may be advantage in some cases to doing both drugs for certainly people with extremely low bone density. But if you want the natural approach, Osteostrong, we're leading a revolution in natural bone health. It isn't a drug intervention. We know that all of these drugs are hormonally driven. As you said before, there's no such thing as a minimal hormone impact when you take them. There's a price to pay or a ferryman. The side effects can be quite significant. For Osteostrong, there are side effects to Osteostrong. You get stronger muscles and better balance.
Yeah, that sounds good.
They're pluses, not minuses.
Yeah, no, this has been absolutely fantastic, Perry. I really enjoyed this session. Can you tell me where can people reach out to you, or your website, or where can people connect with you? Obviously, those places, maybe you can get me a list so that I can put it in the show notes with the links to the ones in Australia. And if there's anyone in New Zealand listening to this who thinks this might be a good thing to get into, please, that would be fabulous. reach out to Perry, and you know, let's get this further around the world so that more people have access to it. You know, where can they connect with you?
So osteostrong.com.au.
Easy.
If they log on there, if people are interested in our locations worldwide, it's osteostrong.me. And you can see the science, the studies that are there. We're doing a big study at the moment with Monash Health here in Melbourne. It's a pilot study, but it's looking at postmenopause women. We'll have that completed hopefully by early next year. It's one of 3 big studies. There's a big blinded study being done in Sweden at the moment. They'll complete that in the next few months. The Greece study obviously is one that's very important, but there's been half a dozen studies prior to that looking at osteoporosis and diabetes and the safety and efficacy of Osteostrong for people. We've got something like 35,000 people going through the process at the moment. We've got over 6 million recorded sessions. You know, obviously, the Osteostrong is an exercise program. Their risks come with exercise, any exercise program. I can't say that it's 100% safe, but no exercise is. Obviously, we take enormous care with our people. There is a risk associated, but that risk, if you look at a gym, you know, people hurt themselves. 1 in 200, 300 people hurt themselves in a gym every day. We've had more than 40,000 recorded sessions in Australia with no recorded injuries. People obviously will have little muscle pulls and muscle soreness from any daily activity. That's not unusual, but that's very different to an injury. That's usually something that just happens because they're deconditioned, they're very old, they've pushed a bit hard today, and you know, nothing more than an ice pack is necessary in those situations. We don't have a very we do have a very safe risk assessment in our process.
And you know, life's got risk in it, and if you go around trying to avoid all of them, you're going to end up with the most risk, i.e. sitting on the couch and doing nothing, and then you're not going to get healthy for sure. Perry, you've been wonderful today. Thank you so much for getting up so early and being a part of the show. I really appreciate you. Absolutely fabulous, great information, and really thank you for your time today.
You're welcome. Thank you, Lisa. Lovely talking.